You might be afraid that the end of life is painful. There is a lot of misconceptions around end of life and pain. So in this video, I'm going to talk about the misconceptions about end of life and pain, what causes pain, how do we manage it, and specifically around the fear about taking pain medicine at the end of life. So to be clear, dying is not painful. The actively dying phase that I show you in many of my videos is not painful. It is a natural process that happens to almost everyone at the end of life if you're dying a natural death on hospice. What can be painful and what can cause the symptom of pain is the disease that you're dying from. And that is what hospice can help with most. Death is a natural process that your body is built for. Pain comes from the disease that you are dying from. And just FYI, not all diseases cause pain. A lot of what I have to do as a hospice nurse is calm people's fears around taking pain medicine. I don't know how many times I've heard people say, I don't want to take any pain medicine, I don't want to get addicted, or I don't want to give them pain medicine, I don't want to make them die sooner. Those are two misconceptions I want to go over today and why those things aren't happening. So addiction. Pain medicine gets a bad rap. I get it. There are many people who do become addicted to pain medicine. What I will say is, if you are someone who is on hospice and is having pain, you have to remember that you're not taking this medication recreationally. You are taking it because you have pain. And many people, when taking pain medicine because they have pain, it relieves their pain and they become themselves again. Many people think that they're going to take pain medicine and become this zombie or be knocked out, and that's not necessarily true. Many times, because people on hospice finally get pain relief, it wakes them up and makes them feel like they're themselves again because their pain is finally controlled. Now, I don't want to act like nothing can happen if you consistently take pain medicine. Your body can become dependent on that pain medicine. And that is something that can feel scary and something you don't want to do to your body. However, the reason why I like to talk about this is because if you have something going on in your body that's causing you physical pain and it's not going to go away because of the disease that you have, you may have to come to the conclusion that you do have to live out the rest of your life on pain medicine, because it's a risk versus benefit here. Would you rather live in pain for the rest of your existence? Or would you like to have that pain controlled and live on pain medicine? It is your choice, but I do think it's important to erase the stigma around it. If you have pain, there's nothing wrong with taking pain medication to help with it. The other thing I hear a lot is from family members who are afraid to give their loved ones pain medicine because they're afraid they're going to make them die faster. So one, there have been 2 different studies done to prove this wrong. So just so you know, there's been studies done on hospice patients who have been given morphine, and those patients that were given morphine did not die sooner than the ones that were not. They just died more peacefully. Again, you have to weigh the risk versus benefit here. Most people don't want their loved ones to suffer at the end of life. So if your loved one is having pain, that is suffering. And giving them pain medicine is not making them die sooner. It's making them more peaceful before they die. And it is not causing them to die sooner. It's helping them just be more peaceful at the end of life. And that's something I have to tell everyone over and over and over again. I also get a lot of questions about, how do I know if my loved one's in pain or if they're not in pain? Many patients at the end of life are nonverbal. They are not telling you, either because they're unconscious, they're confused, or because they are nonverbal because of certain diseases like dementia or end-stage Parkinson's. So how do you know? You can tell by what their body is showing you. Their body will show you nonverbal cues. They might be restless. They might be grimacing a lot. They might be moaning a lot. If you touch them and they guard or they moan, that can be an indication that they are in pain. And that could be an indication that you should be giving them pain medicine. Now, you can always talk to your hospice company to see what they think, but generally speaking, people who can't verbalize that they are having pain will show you with their body. Another thing I like to mention is that not all pain medications are opioids. We can control pain other ways besides giving narcotics. Now, narcotics are great, so I'm not giving them a bad rap, but just so you know, we do use other things. For instance, steroids. I love using steroids for pain, specifically bone pain. Steroids helps decrease inflammation in the body and helps you not have so much pain. So steroids are great. Marijuana. Marijuana, specifically in certain states where it's legal, can definitely help with pain, and also most states have medicinal marijuana that can help with pain. Tylenol seems like it's something that you only use for fevers or headaches, but really Tylenol is also great for pain management, specifically Tylenol suppositories. You know, I always love talking about suppositories. It's because they work. It's because they work and they're underutilized. So Tylenol suppositories. Lidocaine's also a great way to manage pain. We have lidocaine patches, lidocaine creams. The drug gabapentin is a good way to manage pain, especially neuropathy pain. So there's different avenues we can go. And of course, I'm just speaking generally here, so you always want to talk to your physician, your doctor, but there are different ways to manage pain. So what are the actual problems and issues that come with taking narcotics? There are side effects, of course. Number one side effect, constipation. We don't talk about this enough. Constipation is a real issue at the end of life. One, because people think if you're not eating, you won't have bowel movements. False. You should still be having a bowel movement at least every couple days. Now, if you're on narcotics, that's going to be harder because it's going to cause constipation because those narcotics slow everything in your body down. So it's going to slow your bowels down and that's going to cause you to become constipated. So if you're going to be on a narcotic, you need to be on a laxative. And hear this, a laxative, not a stool softener. Stool softeners can be never given for the rest of our existing life, okay? They don't work. No stool softeners. You want a laxative. So if you're on a narcotic, you have to be on a laxative. End of story. Okay? And again, make sure you consult with your doctor. The other problem that can come with narcotics is sedation. Yes, people's respiratory drive does decrease because, like I said, it relaxes the whole body. So your respiratory drive can go down and you can be a little sedated or a lot sedated depending on how much you're getting of the pain medicine. This will change over time. Specifically, if you're not used to taking a medication like our narcotic, you may be sedated or feel like more lethargic at first, and then over time it will dissipate. Again, this is something you have to talk about with your doctor. If it's too much when you first start out, they may want to back off so it doesn't cause sedation. Again, like I said, not everyone who takes narcotics becomes sedated because they need it and it basically controls their pain and then they feel better. So you have to find the happy medium here. And that's where you need to work with your doctor and your hospice team. So remember, if there is pain at the end of life, we can manage that. There are several medications we can use to make you not have pain at the end of life.